Now let's discuss the effects of vaccine mandates and misinformation on both the military and national security. I'm going to make the argument that removal of vaccine mandates for the military will negatively affect national security. On April 21, 2026, Secretary of War Pete Hegseth announced that flu vaccines would no longer be mandatory for the U.S. military. Advocating for vaccines is becoming more and more difficult, especially in an environment of misinformation. This affects both advocating in the community and also advocating on the federal policy level. Ending mandatory flu vaccines, however, is a bad policy. As stated by military author Jack McCullum, American military leaders need to be reminded that disease and pathogens are as great a threat to our soldiers as any human adversary. We just need to look at history and remember the 1918 or Spanish flu. Influenza devastated our military forces. And we need to also remember that the 1918 flu, which caused the pandemic during World War I, likely started in the United States at a military base in Fort Riley, Kansas. There was then another devastating second wave, which began in the fall of 1918 at Camp Devens, Massachusetts, with over 14,000 flu cases. In World War I, U.S. deaths from flu were nearly as many as those sustained in combat. 45,000 deaths from flu, over 53,000 deaths from combat. The military is an ideal incubation chamber for diseases. The combination of cramped quarters, poor sanitation, and frontline conditions makes infectious disease spread rapidly. Disease and pestilence have ravaged soldiers throughout history, and sometimes have even defeated armies. And public health needs to prioritize, not minimize, disease control in our armed forces. Even an imperfect flu vaccine can mitigate outbreaks and reduce severity of illness. Vaccinations have deep roots in the military, as do vaccine mandates, and this can be traced back to the Revolutionary War. George Washington mandated smallpox inoculations for his troops. Smallpox is a highly infectious disease with an almost 30% fatality rate. The type of vaccination which was done at that period of time was called variolation, and this carried a risk, but it was safer than contracting smallpox. The fatality rate for contracting smallpox was 30%. The fatality rate for variolation was 1 to 2%. Now, misinformation has been distorting vaccine risks. The anti-vaccine movement overstates harms and underemphasizes safety data. Vaccines for hepatitis, measles, polio, COVID-19, and scheduled immunizations have long and strong safety profiles. And there are significant harms which can happen from vaccinations, but these are rare, and disease risks are much greater than the rare risks from vaccination. The ready availability of information regarding vaccine safety and effectiveness is of utmost concern. Unfortunately, there is both publication and censorship concerns. Recently, the Washington Post cited that the CDC did not publish and withdrew from publication a CDC vaccination safety study. The study reportedly found COVID-19 vaccines cut hospitalizations and ER visits in healthy adults by almost half. The article states that there were methodology concerns, and these were cited as the reason for withdrawing publication of the data. However, it also describes this methodology and states that it is time-tested and has been used for decades. And the current infectious disease burden which our armed forces faces is not theoretical. Long flu, and long COVID are linked to both workforce and military readiness concerns. For example, there were 185 influenza deaths in Kentucky during the 2025 to 2026 flu season, with 34 of those deaths among people aged 19 to 64. A recent Lancet study reported long COVID symptoms in a quarter of Marine recruits who had had predominantly mild or asymptomatic COVID. Since my publication in the Courier Journal of an op-ed on this subject, not vaccinating the military has transformed from a theoretical risk to a real-world policy which is affecting military readiness. Unfortunately, there was an outbreak of the flu at Lackland Air Force Base in Texas on June 18, 2026. This occurred just 2 months after the Pentagon made the annual flu vaccination for active duty and reserve military personnel optional, as opposed to mandatory. As of June 18, 2026, the Lackland Air Force Base outbreak had 222 confirmed cases, with 2 hospitalizations and 1 death under investigation. During this time, the vaccination rate in our military recruits fell from approximately 100% to 40%. The rapid transmission of the flu virus in basic training is straining both our military healthcare resources and is risking military readiness. Since then, the military has reinstated mandatory flu vaccinations in many areas of the military. Key points are that by the 24th of June, 2026, cumulative cases rose to 275, up from 222 just a few days previously. The outbreak began 2 months after the Department of War ended the annual influenza vaccine requirement. In response, the military service reinstituted requirements that recruits receive influenza vaccinations. And this mandate was in place since 1945, up until the Secretary of War rescinded this requirement. So we need to realize that public health infrastructure is a part of national security, and reduced preparedness and reduced funding weakens our national security. And we are currently dismantling public health agencies and vaccine strategies, which further weakens national security. The NIH has eliminated biodefense and pandemic preparedness as one of its key strategic focuses. An outcome of this is that the University of Kentucky has been cited at risk of losing up to $40 million in NIH funding. And all of this has accumulated into a weakened infrastructure, which is now no longer able to effectively respond to either a pandemic or a biological attack. This is one of the greatest strategic failures and dangers of our current federal policies. So 3 key takeaway points are that vaccinations have long been used to preserve fighting strength and capacity. Influenza and COVID-19 can undermine military readiness through outbreaks and long-term sequelae. Policy, public trust, research publications, and funding all are vital to and shape national preparedness. Thank you very much for attending this presentation.